Hi everyone, I'm Bronwyn Fitz. I'm an integrative gynecologist and functional medicine doctor. Today we're going to talk about sleep. Sleep is something that I hear from my patients all the time. Almost all my patients have some complaint about sleep. And it's funny because it's one of those physiologic processes that's so important and ingrained in our body. It's like we eat, we drink, we breathe, we sleep, and yet we struggle with sleep. And I think one of the reasons why so many people do struggle with sleep is because we live in this go-go world. You know, we're always kind of racing. The society that we live in here in America is constantly kind of on the go. It's this on-the-go lifestyle. And what we're doing is we're engaging, there's sort of two sides of the nervous system. The sympathetic is the fight or flight, and we're constantly engaging our fight or flight sympathetic nervous system during the day. And the parasympathetic, or the rest and digest side of the nervous system, really becomes more dominant at night for sleeping. And I think a lot of us have a hard time winding down and getting ready for sleep. So that's kind of what I talk about with my patients. There's kind of two main complaints I hear about, and the first is I can't fall asleep, and the second one is I fall asleep just fine, but I wake up. So in terms of falling asleep, I really try to encourage people to kind of first look at the bedroom, set the stage. The bedroom should be dark, it should be cool, there should be really nothing else going on. So, you know, charge your cell phone and keep your computers outside of the bedroom, no television in the bedroom. The bedroom should be reserved for intimate activities and sleep, and that's it. Try not to read or, you know, get on your screens at night in bed. You can do that just elsewhere. And you want to keep the temperature cool. Most people sleep better when the thermostat is less than like 70 degrees, if possible. And you want to look at things that you're doing in the hours leading up to going to bed. So I usually encourage people to get off their screens about an hour beforehand. And, you know, speaking of screens, we want to use blue light filters. So a lot of the computers and phones now have sort of a night shift function where you can screen out the blue light. So if you are on your screen at night, it's a little bit more amber, so you're not engaging your retina and telling your brain to wake up as much. And you really want to monitor kind of what you're doing at night. If you're streaming, you know, and you're looking at really wild, kind of intense television programming right before you go to bed, you know, it's hard to wind down. So you really want to, you know, stop watching TV a few hours before bed, and then give yourself a routine. You know, it's funny, I talk to my patients, you know, I'm a gynecologist, so a lot of my patients are moms, and I say, think back to the elaborate bedtime routines you had for your babies and your kids when they were little. So why did those elaborate bedtime routines go away? I mean, we as adults still need those routines. You need to give your body cues that it's time to wind down. So you can do that with a nice relaxing cup of tea and a book, and then maybe take a warm bath or a shower. And then, you know, maybe some meditation. Keeping a gratitude journal is really helpful to kind of get your mind in a nice, peaceful and positive kind of state of mind before you go to bed. So bring back the bedtime routine. And then I usually suggest looking at sort of what you're bringing into your body in terms of, you know, substances like alcohol and caffeine and potentially other medicines that could be interfering with sleep. Things like ADHD medicine, antidepressants, some antihypertensive medicines, certainly pain pills. You know, these can all affect your sleep. So go over those with the doctor and make sure, or a healthcare provider, and make sure that you're not taking something that unknowingly is stimulating you and interfering with your sleep. And then and exercise. So the other thing is exercise is wonderful, but try to give yourself about 3 or 4 hours before, you know, between your last exercise and before you go to bed. The next thing I talk about with my patients is sort of the category of, well, listen, I fall asleep just fine, but I wake up and then I can't fall back to sleep. The first thing I tell people is waking up is totally normal. Everybody wakes up once or twice at least at night. The trick is that most people fall back to sleep pretty quickly. If you are awake in bed for, 20 or 30 minutes, that's probably too long. So although you shouldn't really look at the clock because that can interfere with your ability to fall back to sleep as well, it gives you anxiety. Try not to look at the clock, but also be mindful. And if it's been a while, if you think it's been about half an hour, you should actually get up and you should go to another room and do some sort of low stimulatory activity. Don't get on a computer, don't get on your phone, but maybe read. And then try to be mindful of your body's cues. And when you begin to feel tired again, go back to sleep, go back to bed and see if you can fall asleep. Another reason why people wake up is because they have to go to the bathroom. So monitor what you're drinking in the evening, and some people need to limit, even though a cup of chamomile tea is very soothing. If you're running to the bathroom in the middle of the night because your bladder can't hold it, then sometimes you need to really limit nighttime liquid intake. The other thing is that a lot of people, when they wake up, their mind is just going. So if you feel like you suffer from that monkey mind where you're like running to-do lists and you're reliving, scenes that happened yesterday, or you're reimagining or beginning to imagine things that may happen tomorrow, your brain's really getting away from you and you're kind of self-sabotaging. So that's very common, and I usually really encourage people to learn how to meditate, to quiet the mind. There's many techniques, and the word meditation is like this huge thing, but there are many different ways to learn to quiet the mind. I often give my patients just some really easy techniques for sort of deep breathing, and it's very helpful. And it also comes back to think about the language we used around teaching our kids to sleep. And we would often say, your baby has to self-soothe. You've got to learn how to, teach your baby how to self-soothe so they can get themselves to sleep. We're the same way as adults. It hasn't changed. We still need to learn how to self-soothe and get ourselves back to sleep. So a lot of times people ask me about supplements or herbs and things they can take. Before you take a supplement or an herb, I always suggest going to the doctor or a healthcare professional. Get a consult. Make sure there's nothing else going on. Many people snore. I didn't mention that. So snoring is very common. People can have obstructive airway disease. They can have sleep apnea. There's lots of different, anatomic things that can be contributing to decreased airflow that affects your ability to sleep, and you actually wake up. And those are very significant. So I have a very low threshold for telling people to go get a sleep study and get that evaluated, because it's very important. Obstructive sleep apnea and obstructive airway disease is associated with all kinds of other chronic illnesses. So you really need to get that addressed. But in terms of sleep aids, melatonin is a hormone that helps you fall asleep. You can get it over the counter. I find that the doses sold over the counter are often too big. The doses are much larger than you need. I usually suggest starting with just 0.5 milligram, 1 milligram most, an hour or two before bed. And that will often help many people fall asleep. Doesn't prevent you from waking up in the night. There's lots of other herbs I like, things like chamomile and valerian, lemon balm, hops. There's quite a few. So, when I choose an herb for somebody, I really put it into the bigger context of what else is going on. Does this person have anxiety? Does this person have depression? Does this person, have allergies that we're trying to address? Also, there's lots of decisions that, lots of factors that go into, how I choose sort of an herbal supplement for someone. But there are lots of herbal remedies that can help for nighttime relaxation and also for sleep. So one of the most important things, I think, is for people to prioritize sleep, to really, put it up there as one of the most important things, and think about some of these tips that I've given you. Go back to basics. Think about setting the stage and learning to self-soothe. Give yourself a bed routine, and I hope everyone has a restful night this evening.